I'm Siegfried, a nurse practitioner with a 22-day weight loss program. I'm going to talk today about the different kinds of weight loss programs, why some are successful, some aren't. I mean, there's a bazillion programs out there. There's the Atkins, the Zone Diet, MetaFast, Slim Fast. I mean, the list goes on and on and on, okay? They all have their pluses and minuses. I'm going to talk about the philosophy of our weight loss program, why I think it's the best. But I'm going to tell you how the whole process of weight loss works so you can make an informed decision. So when you put something in your mouth, your body breaks it down into 3 macronutrients. You got carbohydrates, proteins, and fat. Now, when you eat carbohydrates, your body breaks that down further down into glucose. That causes your insulin to go up. Your insulin drives the glucose into the cells until it's all filled up. Then after it's all filled up, it converts that into fat. Okay, that's done in the liver. So basically, you eat too much carbohydrates, your body has no stores left, you start to make fat. And with today's, that's why high carbohydrate diets are hard to lose weight on, because if you constantly are stuffing your body with carbohydrates, your body can only store so much stuff, and then it starts to store it as fat. Okay, so you can, there's a philosophy out there, calories in equals calories out, the law of thermodynamics. You know, you got to, if you eat too much carbohydrate or too much calories, then what happens, of course, after you exceeded what the amount your body burns, then you start storing stuff as fat. The only problem with that philosophy is that our body really isn't a one compartment system. It's a 2 compartment system. And let me explain the difference. A 1 compartment system is like, look at a sink. Water goes into it and then water comes out of it. So what they're basically, the calories in, calories out, they're basically saying you eat calories, you burn it off, and that's it. The trouble is, like I said, our body is a 2 compartment system. You can look at it as, let's say you're going shopping, okay, and you're buying a month shopping trip, and you buy a lot of food, okay? So you're gonna store some of that food in the refrigerator, and let's say you've got a freezer that's outside in the garage, and you're gonna store some stuff in the freezer. Now, the body takes the easiest, the path of least resistance, okay? So what the body likes to do, it likes to just grab stuff out of the refrigerator. It's really easy. It's in the house, you know? So that's what the body likes to do. And you can look at that compartment as your glucose storage, glucose and glycogen, okay? Your body has a limited amount of that, okay? You can store about 2,000 calories worth of that. Now, the freezer, which is in the garage, it's much harder to access, okay? You gotta go outside, go into the garage, pull the stuff out of the freezer, thaw it out before you can actually use it. So that's like the body's fat stores. Now, pretend there's a mean neighborhood dog out there, all right? Really mean. Now, whenever that dog sees you go into the refrigerator, it goes right outside the door and is waiting for you. And so you look out there and it's like, I can't get to my fat stores or freezer because there's a mean dog out there. Well, the dog is insulin, okay? The dog's name is insulin. So as long as insulin is around, you cannot get to your freezer or your fat stores. So that's the difference between a 1 compartment system and a 2 compartment system. The 1 compartment is just basically calories going in, calories coming out, and the 2 compartment system is basically you got 2 storage areas. You got a glucose storage area or glycogen, and you got a fat storage area. And as long as insulin is around, your body is not going to allow you to use those fat stores. So if you are constantly eating carbohydrates, insulin's always going to be around and you're not going to be able to burn fat. Okay, so when you're younger, your body can tolerate having high insulin levels very easily. So as you get older, your pancreas starts to kick the bucket. And at that point, now you have diabetes. Okay, and at that point you need to go on medicines and sometimes have insulin shots. So when you have a high level of insulin in your body stores sodium. The more sodium you have in your body, the higher your blood pressure. That's why it's called metabolic syndrome and has this trifecta of things. You tend to have insulin resistance, high blood pressure, and you tend to be obese as well. Okay, so diet all by itself can change all that. So if you start limiting the amount of carbohydrates in your food, and you can do this by yourself, you don't actually have to go to a weight loss program to do this. Start reducing the amount of carbohydrates in your food, your insulin levels will start to drop. Your blood pressure will drop. If you have diabetes, you can get off your diabetes meds, because the only reason you have diabetes is because you're eating carbohydrates. So, for example, me, I was pre-diabetic. When I cut out the carbohydrates, my hemoglobin A1C dropped. My fasting insulin, it's at a level of 2. When I check my patients, a lot of them are like 10 to 15. So what happens with insulin is when you eat something, your insulin level increases by 5 to 7 times, okay? So if my insulin level is 2 and it increases 5 to 7 times, it goes up, 10 to 14, no big deal. It comes down in a couple hours. But if your insulin level is 10 and it increases 5 to 7 times, now your insulin level is 50 to 70. It takes a long time for your body to actually recover from that. And you're actually not going to recover before you eat your next meal. So your insulin level is constantly really high. So that's why low carbohydrate diets like the Atkins or the ketogenic, that's why those diets really work. So what happens is that your insulin level is really low or non-existent. So your body has a chance to recover. And then it starts actually burning, because you're out of your glucose, glycogen stores, your body starts to use or utilize your fat stores. Now, it's not a fast process. You do tend to lose initially quite a bit of weight really fast, but what's happening there is because now your insulin level has really, really gone down, your body starts to get rid of sodium. And because it's getting rid of sodium, it's also getting rid of water. So you do have quite a bit of water loss that first week, okay? So basic philosophy is keep your carbohydrates low so your insulin level will be low, and it will allow your body to utilize your fat stores. And that any program, and I mean any program that allows your body to do that, will allow you to lose weight successfully. Okay, so this is Zick for your 22-day weight loss program. Hope you enjoyed that. Thanks. Bye.